So I think the education piece is massive. I think not only in young people, I think the focus at the moment is on, sex education in school, but actually there's a whole heap of, you know, older people who also are not taking pride in their sexual health and well-being, or don't even know where to start. There's people who still think sexual health is only for promiscuous young people. you know so women are not only women, but people are splitting up from regular relationships that they had. They're dating again. They forgot about STIs. They forgot about contraception. So even actually abortion rates, we have had the highest abortion rates since the implementation of the law. But it's on the rise on the over 35s as well. So we had obviously the teenage pregnancy strategy, which we worked hard and we, really got teenage pregnancies down. But then, what we're finding now is that we've had a massive surge in the over 35s.
Hello, and welcome to Menopause Whilst Black, the podcast. We are committed to sharing the stories of Black people in any stage of menopause, primarily, but not always, based in the UK. My name is Karen Arthur. I am your host and the founder of this podcast, and we're in season 8. Episode 7, I believe. Goodness me. We're almost at the end of this season, and I've loved speaking to the diverse roster of guests, and today is no exception. So, however you listen to this podcast, whether you're going for a walk, going for a run, at the gym, I said all active things, didn't I? Sitting down on your sofa, watching nature, however you're doing this, I'm glad you're doing this, and I'm glad that you're here, and I know that you will enjoy it. I'll see you on the other side. Bye. Hello, and welcome to Menopause Whilst Black, the podcast, season 8. This is the podcast that is fully committed to sharing the menopausal stories of Black people in any stage of menopause. And I have a new guest for you today. I don't know why I'm singing. I'm a bit hyper because I went for a run and it's really cold outside, and now the endorphins are kicking in. Anyway, let me read this incredible bio. Simphiwe Sesane is a speaker, host, medical educator, and an experienced contraception and sexual health nurse consultant, a faculty of sexual and reproductive healthcare trainer. She is also the founder and CEO of Black Nurses and Midwives UK. Simphiwe has a special interest in contraception, menopause, Black maternal health, and improving sexual and reproductive healthcare access for marginalised and vulnerable groups. She has had her expertise published in various articles, including The Guardian and The Telegraph. Simphiwe is also very active on social media at Black Nurses and Midwives UK. Other features include podcasts, radio, parliamentary groups, and the Davina McCall's Pill Revolution documentary. Simphiwe was an award nominee finalist for the Caribbean and African Network Black Healthcare Awards last year, and an award for the motherhood group Black Maternal Health Awards this year. Through Black Nurses and Midwives UK, Simphiwe delivers impactful events supporting Black students, nurses, and midwives to thrive in their careers. Simphiwe has become a speaker of choice at events. She passionately shares on women's health with emphasis on equitable healthcare. Welcome, Simphiwe.
Oh, thank you so much, Karen, for that introduction, and thank you for having me. I'm super excited to be here because you're just amazing and so inspiring.
Oh, thank you,
You are.
baby girl.
You
So,
are.
tell us about yourself. Who
I
are
feel
you
like you've already
outside
introduced
all of...
me. Well, I must say, first and foremost, I am a wife and a mother
Mm,
to two beautiful babies. So I have little Zanita, who's 7, and then I have Zane, who's 2 years old, and they are my absolute pride and joy. So yeah, family for me is definitely everything.
mm,
And then yeah, I guess professionally, I've worked in sexual and reproductive health for over 10 years and have definitely grown a passion for women's health and especially advocating for Black women and brown women, just
mm,
because being Black woman myself, I've gone through my own health journeys, which I can't stop talking about. My husband cringes at that point, but yeah, definitely passionate about sharing because I think sharing is important in
mm,
educating others, but also I think seeing women who look like us sharing their journeys because I think like you always talk about the whole not hanging your laundry out, I think as Black women we don't really like that because we've been taught not
mm,
to share
mm.
our personal stories, but I think there's power in sharing and power in education.
Absolutely. And that's why the podcast
Definitely.
exists, isn't it? Is that I feel like there are so many stories. Menopause, one size does not fit all. And so talking to as many
Completely.
people about our own health shouldn't be a taboo anymore. And I'm glad that people
No.
like you, and the guests that come on the show and more people that are opening up and saying, you know what, is enough enough. Enough is enough. Is enough
Yeah.
enough enough? How many times
Enough.
can you say enough in one sentence? That's the question. So, what's your
Yeah.
heritage? Where are your parents from?
So I actually am born in South Africa as well. But my background, I guess, I am born to a Zimbabwean mother
Mm.
who grew up in South Africa, and my father was South African. I was born in South Africa actually as well, and lived the first 9 years of my life there. So lived 20 odd years in England. So yeah,
Okay.
that's my background.
And where are you based now?
I'm London based. Yeah. So
London
I'm a
based.
Londoner. I mean, I did move to university in Northampton. I don't know if that counts.
No, it doesn't. You don't even try it.
I feel like it counts. I went up north
You're not having.
for
I'm not
three
giving
years.
you that.
So I'm gonna claim that and say, yeah, I'm a Londoner. But yeah, I lived in Northampton for 3 whole years to do my nursing, and literally the day my university finished, I literally
You
drove myself
ran
home.
back. Oh my
Yeah.
goodness
No,
me.
Northampton was definitely a great experience, and I was
Yeah.
based between Northampton and Milton Keynes.
Okay.
And I think it definitely taught me so much. Being 18 and doing nursing was very eye-opening, and not being at home too. So
Mm,
I
mm,
think that was a journey and a half. So yeah, no,
mm.
but I definitely enjoyed it.
Oh, good. I'm glad.
Yeah,
I'm glad you did.
yeah.
You can claim Northamptonshire. I'll let you.
Ah, thanks.
So, how old are you?
How old am I? I'm
Yes,
very young.
you're a baby.
No, no. I think I probably look a lot younger than I actually am because I think the
Okay,
short hair probably doesn't help, but I'm 33. I'm
okay.
turning 34 in a couple of weeks' time, actually. Yeah,
Oh, birthday coming up. Are you Aries
yeah.
then? Does that mean?
I am an Aries. Yeah, I
Same.
am an Aries. So, yes, 34
Wonderful.
young.
So the reason I wanted to get you onto this podcast is not to talk about your own menopause journey, but to talk about the incredible work that you're doing with your, Instagram that I came across, and I've been following you for quite a while time. And it's
Mhm.
amazing the stuff that you share. I'm learning things about menstruation, about periods, about equitable care and that kind of thing. How did you, when you went to university to study, what was the course that you studied?
I did nursing.
Right.
So I did, yeah, nursing for 3 years.
So, how did you go from nursing, moving into specifically focusing on equity and Black folks? Tell us a little bit, maybe about your story, because that will
Yeah.
have brought you there, I suppose.
No, definitely. So when I went to university, I think nursing, a lot of the time you're told that once you qualify, you have to work in acute care. And one of the key things for me was that I knew I didn't want to work in acute care. So I wasn't an acute care sort of nurse, so working in like the
Mm.
hospitals. I always knew. So my mom's a nurse and a midwife by background, and actually had an interest in sexual and reproductive health as well, and has worked in this area for many, many moons. So I've always sort of had an interest in that field. And when I qualified, I'm not even going to claim this one. This one's one I'm not going to claim. Because I was told you have to go and consolidate and work in acute care, I did it. I think I survived 3 months, if that, 4 months. I despised it so much. And this is
Really?
why I think it's so important to emphasize actually for nurses and midwives who qualify and want to go. I think it's so important that there's so many different fields in
Mm,
nursing, and
mm,
it's amazing that we all like different things. So if acute is for you, like working hospital, kudos to you. But for me, it wasn't the one. So I then shortly after went into sexual health, and that's where I found that I loved it. I loved speaking to patients. I
mm.
loved testing, talking about different sexually transmitted infections, how how they acquired, and
Yeah.
just educating individuals about their health. And then actually started going to schools, and networking with sort of a lot of young, well, I guess it's not called networking, education for a lot of
Mm,
young people. And I
mm,
actually really loved it. I enjoyed every moment of it.
mm,
And I knew that that was my field. So I worked in sexual health for a very long time. And obviously, I was seeing men, women. But I think I definitely had more of an interest in like contraception. So I
mm,
trained in contraception and fitting implants, coils, and things like that. And that's
mm,
when I became a trainer. So teaching doctors, nurses, midwives, contraception and how to
mm,
fit coils. And then I seem to have moved into women's health. So I then worked in abortion services as well, leading for contraception. So I was the lead contraception nurse and just talking about the importance of contraception post abortion and why that's a prime time to also talk about contraception. Because I think sometimes we think, oh, they've come in for their abortion and then that's it. But actually, sometimes it's important for us to really go into what the different options are, and that might be a prime time for them to get their conception. So I led on that and did lots of things like commissioning of services, really thinking about innovation in contraception care, just because
yeah.
around the time there was COVID as well. So yeah, we had to be very creative, especially with things like implants and coils, because obviously you couldn't really be in a room with somebody for that, prolonged times. And there was times where we had to stop those procedures for a short time during COVID. So I did lots of stuff around that. And then currently I work in a pharmaceutical company and I lead on medical education. So again, bringing all my skills and
Yeah.
knowledge and doing a lot of teaching. So education is definitely something I'm passionate about.
Yeah. And do you find, from a personal point of view, because obviously you work with young people, talking about
Mhm.
contraception, talking about periods, talking about women's health, that kind of thing. Tell us about your own journey. Tell us about your, because you have a couple of, two beautiful children. Were
Yes.
your pregnancies straightforward?
Yeah. And I guess, yeah, you did ask me to talk about where I ended up, how I ended up
Mhm.
in equity. And yeah, I guess that's probably
I
when
just
I
want to
found
hear
my
you
voice.
talk, baby. That's all. That's all. I'm
Well, I can
fine.
talk for days. So yeah. Um, so I think, to be honest, I think we started talking about equity in health.
Mm,
We've been talking about it for a long time.
yeah.
But I think obviously the pandemic exacerbated in terms of health inequalities, and there was so much that was highlighted during that time. And obviously, working in sexual health, we know that certain STIs disproportionately affect the Black community as well. So if you're thinking about HIV and things like that,
Mm,
the history of HIV, we know that there are pockets of Black individuals impacted by this. So I had
mm,
an interest in terms of that area as well. But I think for me, I found my voice when I had my child.
mm,
So my first child, my 7-year old, unfortunately, I didn't have a straightforward pregnancy. Um, Not too complicated, but I'd say the birth was probably very complicated.
mm,
Unfortunately, me and both baby and I were very poorly post birth. And again, it's those things that we hear about all the time: Black women not taken seriously, not listened to. And a lot of it is it was preventable.
Mm.
I'm a nurse. I can advocate for myself. My mom's a nurse and a midwife, and still, we were not taken seriously. We kept escalating, um, how I was feeling, and they were like, no. Even the pain, I was being dismissed that no, I wasn't experiencing the pain. I went to hospital and they said, no, you weren't dilating. My waters broke first. So a lot of the things that happened were just, things you've probably heard again and again.
Yeah.
Because then we went into hospital and we sent home, and then told to come back for an assessment the next day. And yeah, it's just frustrating. And I think that's when, after having her and just going through that experience, I think that's when I sort of became very vocal around the disparities, especially around maternal health,
Yeah.
because of my personal experiences. Because I think sometimes we also put a lot of onus on women advocating for themselves. But even if we do, we're not taken
Yeah.
seriously,
And that must
and I
be
think,
hard because
mm,
you're a nurse. Like,
I'm a
I
nurse.
think there's part of you. I mean, I might be wrong, but you kind of go into the hospital thinking, "Oh well, it'll be fine because I know what I'm talking about, and they're obviously going to take me seriously because I'm a nurse." But you're also a black woman.
Yeah.
That
And,
must have been hard.
as much as it should be comforting that I'm a nurse, it's
Mm.
not. It wasn't, unfortunately, because the statistics. And at the time when I had my daughter, we were 5 times more likely to die during childbirth and then the postnatal period. So I think for me, yes, maybe to some extent, I was comforted by the fact that I'm a medical professional. I understand the jargon, so they can't kind of you
Yeah.
know, blindside me with that. And my mom was a nurse and a midwife, so I felt more, yeah, confidence probably in my mom rather than actually feeling safe,
Right.
you know.
Yeah.
And actually, when we had that experience, it, you know, I felt so not let down, but it also felt personal because obviously I've served in the NHS for so long,
Yeah.
and you just feel like it was just a whole whirlwind, and unfortunately it impacted even our second pregnancy because
Oh.
the trauma from that birth, so we had to have like the trauma team input for that pregnancy, because yeah, I was just petrified,
Oh,
absolutely
bugger.
petrified. um yeah.
That's it. It's heartbreaking to hear. Thank you for sharing that. It's heartbreaking that a time when you need to be and you want to be as relaxed and as calm as possible is a time that actually you're on edge and
Mm,
you're hyper vigilant and you're every cell, every nerve ending is standing to attention because you don't know what's going to happen. Um, and obviously for your second child, an even worse situation because you go in already,
with the
knowing what could happen. You
mm,
know.
definitely. I mean, the second time round, I feel like the midwife I saw at my booking appointment was, like a godsend, honestly.
Oh,
I think she recognized early on. She was like, I think early on I thought I want a cesarean, and she was like,
yeah.
okay, let's talk about that, and she asked me all the right questions,
Mm,
and really made me feel, comfortable for me to
mm,
share.
mm,
Because I think what happened in my first time was that I was told that you're young, you don't need a cesarean, why do you want a cesarean? But I think
right.
for me, there was a sense of control and, feeling empowered that actually I can have a cesarean, let me just
Mm,
have that. And I think knowing that 5 women were 5 times more likely black women specifically, I
mm,
think for me, yeah, cesarean just seemed to be what I wanted. And I had
right.
so much pushback, and actually I ended up in a cesarean anyway with my first child. So
Mm,
second time round, I feel like, she honestly, everything I said to her, took
mm,
it, and I felt really listened to, and she supported both me and my husband,
mm,
and referred us into the trauma team. So there's a specialist team where if you've undergone a traumatic birth, then you can have extra midwife input and support. We only had our debrief to do with our previous pregnancy when I was now pregnant. So that was even,
Oh wow.
yeah. We were never offered a debrief with our first child. So I think, yeah, that would be one thing I would say to anybody is always ask for a debrief. I think I just probably just pushed it at the back of my mind. I thought she's healthy. I'm okay. We survived, basically.
And also, you don't
And sort of
necessarily
moved
want
on.
to have go back to the hospital and have another conversation.
Yeah.
You might even be in shock. You don't know. You
Yeah.
know.
So I think we just moved on, just being really grateful to God that Zanita was fine because she was
Mm,
out of water for
mm,
3 days. And, when they took her out, her heartbeat had crashed and we literally were run to theatre. So I think for us, it was just having a healthy baby.
yeah.
Um, and we just moved on and then we're pregnant again. And then it was like, ah. So being pregnant and having to have a debrief was probably not ideal, but I think it was also good to have those discussions so that we can put things in place on a second time round.
Mm. And I think that you cannot underestimate the power of having someone who listens to you when it comes to when you're pregnant, whenever you go to the doctors or have to
Oh,
visit a
completely.
healthcare professional, the fact that you're listened to, and the fact that someone seems to care about, your what you're going through
Oh,
and if they
completely.
don't know the answers, we'll go and find out. I think that's absolutely
Hmm.
huge.
Yeah.
And how did you move? So you worked in contraception, you worked in obviously healthcare, you have a special interest. You said you found your voice when you had your first child. Tell us a little bit
Mm.
more about that.
No, definitely. So I think in terms of the disparities have been there for a long time, Karen. We know
Yeah,
this,
yeah.
but I think we
Tell
were.
people who don't know.
So, so I mean, now it's definitely changed. So, Black women have always been, historically, had
Yeah.
you know more catastrophic
Mm.
consequences during childbirth. So now I think it's something like 2.8 times more likely to die during childbirth and in the
And it
postnatal
shouldn't
period.
happen though, should it? It shouldn't happen
It's
anyway. It shouldn't be
preventable.
anything. Yeah.
Yeah, a lot of this is preventable.
Mm.
Health inequalities are unjust and are avoidable. I
Yeah.
just want to say that again. They are unjust and they are avoidable.
Mm.
So, and we know that, Black babies are more likely to have die in the postnatal period as well. And cancer diagnoses are often in later stages, and that's various cancers,
Yeah.
from even bowel to
Mm.
breast to various cancers. Menopause journeys, I'm sure you've spoken about this,
Mm.
we're less likely to be offered HRT. I mean, HRT might not be what we want to,
Mm.
use, but we should be having conversations where we're given choices. And I think
Yes.
sometimes in healthcare, we're not given choice. We know in contraception, Black women are more likely to be, coerced into using long-acting reversible methods, so that's implant coils, because there is still the belief of that we procreate rather than other populations. So
Yeah.
there are definitely, those um, statistics that
Yeah.
exist, and those belief system. You know, we could go on and on
Yeah.
and on.
Absolutely.
Diagnosis is definitely a lot later, a lot more progressed, and in later stages, which means the prognosis is usually poorer.
Mm.
So yeah, it's definitely important, and I think that's why I share my story, but also do a lot of health education, because I think it's important to empower our community so that they're ensuring that they're going and seeking help early, because
Mm.
early diagnosis is obviously preventing illness is definitely
Yeah.
always better. And we want to prevent illness where possible. But
Mm.
if there's any change, it's knowing who to go to.
Yeah.
It's knowing that you have the right to ask for a second opinion. I hope it never gets to a third, but if it has to be third and fourth,
Mm.
then you do that. It's important that, yes, you might not be comfortable to go and see a healthcare professional, but we still need to navigate seeing health professionals. They are
Mm.
part of our
Yeah.
care and keeping well.
Mm.
So how do you advocate for yourself? How do you take somebody with you so that you're going to places and you're getting the care that you need?
Yeah. And also, you talked about having choices when it comes to
Mm,
menopause care or any care. And also, I'm hearing of Black women who are being given old formulas of HRT and didn't
completely.
know about
The
transdermal,
newer ones.
didn't know about the
Mm,
gels, didn't know about the sprays because no one offered them those, And
wow.
I always send people back to the doctors and say, tell them you don't want tablets. Tell
No.
them you want something else. You want something more modern and therefore safer. So these
Safe
things are
completely,
important.
and that should be at the forefront of the conversation.
Yeah.
I think it's important that we're having, conversations where we are putting everything out on the table, and these are the
Mhm.
risks with this and this is the risk with this.
Mhm.
You're low risk because potentially you don't have any medical conditions, your family
Yeah.
history doesn't have, but we should be having those open discussions with our patient, and the
Mm,
patient is at the forefront of our decision making,
mm.
and you're involved in that conversation. Nobody should be making choices about your body without
Yeah.
your input.
Yeah.
So that's very, very important. And ask questions, because I think we're often scared about asking questions. Question what they're
Mm,
saying to you.
mm.
Nobody can advocate for your body better than you. I know that we should be your biggest advocates, but at the same time, not everybody has our best intentions at heart.
Yeah.
So ask questions. If you have to get a second opinion, to make you feel comfortable, do that, you
Mm.
know.
I remember this asking questions business. It's almost like people don't want to feel stupid. And yet, how would you know? You
Mm,
wouldn't know. You haven't had the education. There's a couple of things about asking questions about don't be afraid to push yourself outside your comfort zone in a sense because we're used to um, complying and we're used to doing as we're told, that kind of thing. But you can explain this to me like I'm five, please. I mean, I
yeah.
say I do this all the time, but I will say that I didn't start to ask questions till I moved into perimenopause and I started to not really care. Like in when I was teaching, I never put my hand up in as loud as I am and as vocal as I am now. When I was
Mm,
in my mid 40s, I wasn't asking anything. I was if people use jargon or people use big words I didn't understand, I just didn't understand them, or I went and Googled them later.
mm,
And there's also what they call the white coat syndrome, where you assume that the
yes.
person in front of you knows what they're talking about. And they
Mm,
don't, they don't, well, they do, but sometimes they don't. And that's okay. But as long as they admit that and you can have a conversation
completely.
together, you know.
Yeah. Yes. And write things down, like honestly, because obviously for us as professionals, we have to
Mm,
do like testing, for instance, according to what you've said to us. So a lot of the time, where it might seem like we're impersonal and we're just typing away, but
mm.
we're needing to also document what you've said
Yeah.
to us, and then offer you the appropriate testing. But it's important to diarize, especially symptoms, things like
Mm,
periods or what symptoms you're having. With
mm,
menopause, we know that you know, black women experience different symptoms. They're not
mm,
necessarily getting the classical, we always talk about hot flushes and, you know,
mm,
whereas we know that our menopause symptoms can be different. We're more likely to have things like pain in our joints,
mm.
urinary symptoms sometimes. And I think sometimes it's listening to what that woman is telling you,
Yeah.
about their symptoms and asking more questions.
Mm,
And it might seem like we're really being intrusive in your journey, but it's just to ascertain like what testing we may need to do. Sometimes we may ask you to diarize it yourself if you're not already doing that. And there's so many amazing apps, especially in terms of diarizing periods, diarizing menopause.
mm.
There's so many amazing apps which can be your best friend.
It's interesting because you talk about diarising, and there are a couple of schools of thought on diarising. Some people are very vocal about using the different apps to track your periods, for example,
Hmm.
or to that kind of thing, or using, I don't know, Balance or Stella to track
Yeah,
your menopause. And other people are much more vocal about writing it down. Write
yeah,
that
yeah.
shit down. Like use a pen and
Yeah,
paper and put it into a book.
that's true.
Um, which camp do you fall into? Or does it not matter? Are you going to fall on
Do
both
you know
sides?
what? I
Because
think
it's
I think
about,
for
it's about
me,
keeping in touch with your body.
Yeah. Oh
And I
God,
think
being
that
in tune. So
there
I
can
think
be an over-reliance on tech, is what
there
the
can.
people are saying. Yeah. Go on.
Oh,
Sorry.
and definitely there can be an over reliant on tech, but I think it's there. It's in one place. Just
Yeah.
click, click, quick.
Yeah.
What if you lose your paper? um, you know, but I think it's not about where it's documented. It's
Yeah.
about the fact that it's documented. I think is
Yes.
what is important.
Yeah.
So whether you're a writing sort of person, because there's some people who write it into their diaries and they also write about their day or their
Mm.
reflections, but there's some people who actually want that whole typing. So whatever
Yeah.
form suits you,
Yeah.
is whatever form that works for you is what is important. So I think it doesn't matter as long as it's documented somewhere.
Right. Yeah. Absolutely.
Yeah.
So,
I know that actually I was going to say, I know some people are also worried about having too much on an app, especially our
mm,
black sisters and brothers. They really like where's this information going? Who is
yes.
keeping my information? So there is.
Understandably,
Oh, completely.
understandably, that we have a healthy mistrust of authority in terms of where our data is going. I think
Oh,
everybody
completely.
should.
Yeah.
But yeah, there's a history there, so I get that.
Yeah.
I
Yeah.
totally get
No,
that.
definitely. And I think do what you're comfortable with at the end of
Yeah.
the day, do what suits you. And
So
I
you
think that's what's missing in healthcare is that individualized care.
Yes, absolutely. I mean, I always used to write things down in my notes, just write down when I went to get the doctors because I was aware there wasn't a lot of time. So I'd write things down and make sure that I got to the end of that list. I think
Mhm.
for me, there's also, not for me, I think generally in healthcare, I want to see more of menopause, the dots being joined. I spoke to somebody earlier in the week who was talking about she went to the doctors for different things. So she'd go because there was a hip problem, and she'd go because there was a knee problem. And no one was saying, oh, these could all be connected. You see what I mean? And I think that
Mm,
that's what we want more of, you know?
yeah, it's really that joining the dots.
Mm,
I had a cousin actually who had a trapped nerve in her shoulder,
mm,
and I was like, I think it's perimenopause.
mm.
And she went back, and they were like, no, no, they wouldn't even have the conversation,
Ah,
referred her to physio. And I was like, start
something.
HRT, and see how you go. And she did do the physio, but did start HRT, and actually there was improvements as well. And
Mm,
I know that not everybody wants to start HRT, but I think again, going back to having that open discussion, weighing up pros and cons is important. There
mm.
are people who try other things for their HRT management and it works for them. I think it's definitely important that we're individualizing care
Yeah,
um,
yeah.
because there are so many.
You mean menopause
Yeah,
management? Yeah,
yeah,
yeah, yeah. Absolutely.
because it's not like you said earlier. It's not one size fits all. Even with contraception,
Yeah.
we need to have that discussion and talk about what the options are and, thinking about that individual as well.
Yeah. So, what are the most common conversations you have, either with patients or just generally talking about menopause when it comes to menopause care, whether it's, whether someone is actually going through menopause or how they are going to look, after themselves? What do you find yourself repeating over and over again? And what are you always surprised? What are you surprised about? Is there anything you're surprised about that people
So, in
don't know?
terms of patients, well, I was going to say actually, I think the biggest people I have menopause conversations with is my family. Everybody's on Gina. And yeah, I'd say that it's actually, it's, I feel like nowadays, like this generation, my mom's
Yeah,
generation, so we've got a massive family. Like my mom
right.
comes from a family of like 13. And majority girls, and barely any of them used HRT.
Mm,
So I feel like now, my cousins who are sort of in their mid 40s and stuff,
mm,
it's off, we constantly, I think also because I've worked in sexual health, like
mm,
sex and like menopause is a conversation we're always having. So I'd say majority of the time, I think people don't realize the symptoms. So even with patients, that
mm.
there's like, I think now we're almost close to 60, aren't we, in terms
Yeah,
of
easily. If not
symptoms?
more.
Yeah. And all these weird and rare symptoms, I think we're still thinking of hot flushes, night
Yeah,
sweats, the usual classical ones.
yeah,
Um, I think we're getting better at raising awareness around sort of brain fog, um, the mood, like the real
mm,
mood, up and
mm,
down element, um, and the urinary, just the genitourinary
mm,
syndrome, in menopause. We're getting much better at talking about that and the impact for couples as well,
yeah,
because I think, we've not really we focus on the woman.
mm,
We don't really do any education with the men, and then we're not even talking about the impact on their relationship.
yeah,
And I guess being a sexual health professional, for us, we are constantly talking about sex, pleasure, and, different aspects, because there's other conditions as well, not thinking about menopause, but thinking about conditions where women have things like vulvodynia, vaginismus, where there's spasming of the vagina, which can cause
mm,
pain during sex. There's also conditions like endometriosis, which can cause, so I think for me, I'm always thinking of, you know, other conditions that can cause pain during sex, and just really ensuring that we're educating women. Because I think as well, women don't come to you and say to you, "Oh, I'm having this issue." They don't necessarily. Sometimes they tell you things in a
yeah,
cryptic way before we actually say,
mm,
and especially with our Black community, we're not direct, especially for having things like pain or
mm,
during sex. We don't necessarily say it outright. This is what happened. We might tell you other symptoms, and then we may then get to that point. But I
mm.
think because there's still such shame and stigma surrounding sex,
Yeah.
um,
And
it's
there's
still
that
a taboo.
dichotomy as well. There's that thing around
Mm.
Black women being seen as sexual creatures,
Oh,
and yet
completely.
society, women are not allowed to enjoy sex. And so it's
Yeah.
almost like, well, where do I? So we're not encouraged to talk about the fact that not only do we enjoy sex, but we don't. Therefore, we'd like to not have pain.
Yeah.
So there's that thing around speaking about intimate things, but
Yeah.
also I don't know. It goes up against everything that society tells us about these sex ravaged black, exotic creatures. Um,
Mm.
it's really weird, you know.
It is. It is. But I think there is definitely, I feel like the myths and the taboo, the stigma that
Mm,
still, obviously exists today. And then also like this view on not only Black women, there's obviously that
mm,
one you've
yeah,
described,
yeah,
but also Black men. There's all these
yeah.
negative
Absolutely.
connotations around, their promiscuity, and,
Yeah,
they don't keep it in their pants, and, they just, having sex with everybody. So I think there's all of that as well, that could also play a massive role in impacting why, we delay seeking also the help in
mm,
terms of our sexual and reproductive health, but
mm,
also lack of education in terms of symptoms. I think people still think STIs, a lot of them cause symptoms, but you might
yeah,
not. Chlamydia,
yeah.
you might not have symptoms.
Mm,
Gonorrhea, you might not. It doesn't mean you don't have that STI.
mm,
So I think the education piece is massive. I think not only in young people, I think the focus at the moment is on, sex education in school, but actually there's a whole heap of, you know, older people who also are not taking pride in their sexual health and well-being,
yeah.
or don't even know where to start. There's people who still think sexual health is only for promiscuous young people.
Mm,
you
mm.
know there's just a whole, we could talk about that forever.
Yeah. And
Spend all day listening
Is it
about it.
true that STIs are on the rise in
Yes, and
people
that's,
over like 40 and above? I mean, I don't want
yeah.
to make up statistics, by the way.
No, they are
What is
definitely. I
that
mean,
about?
STIs
Because
are on the rise.
surely you're
Even,
old enough to know better. No? Does it not work that
yeah,
way?
but I think, you see, those are also the myths that are
Yeah,
definitely there, that you
yeah.
should know better. But I think women are, not only women, but people are splitting up from regular relationships that they had. They're
Mm,
dating again. They forgot about STIs. They forgot about contraception. So even actually abortion rates, we have had the highest abortion rates since the implementation of the law. But it's on the rise on the over 35s as well. So we had obviously the teenage pregnancy strategy, which we worked hard and we, really got teenage pregnancies down.
Mm.
But then, yeah, what we're finding now is that we've had a massive surge in the over 35s. And it's
Wow.
not just gonorrhea, chlamydia, it's even syphilis. So we've been finding syphilis, which is like an old sexually transmitted infection in heterosexual couples as well. So I think obviously things like PEP. So PEP is post-exposure prophylaxis, which is taking HIV medication to prevent HIV. If you've already had exposure, so you've had sex
Mm.
already, or there's PrEP, where it's pre-exposure, where you're taking ARVs to prevent HIV acquisition, so you take it before having sexual encounter. Those have definitely been game changers in sort of HIV acquisition, but I
Oh, yeah.
wonder whether those are also impacting in terms of people, because that's, was the death sentence for
Yeah.
a lot of people.
Yeah.
Now we're a bit more relaxed with everything else because we're like, oh, that's treatable. So,
So why, I'm fascinated by this, over 35s thing. So why are people not using condoms, for example? Am I being old fashioned here? Or is that literally around, is it around feel? Is it around not wanting to have a
mm,
conversation, being embarrassed? You've got a new partner. I'm answering my own
mixture.
question.
Yeah. And I think you've literally nailed it there. I think that
Mm,
it's multifactorial. There's definitely the whole still not feeling comfortable. I mean, a lot of the time I'm talking to women about, talking about what you like
mm,
sexually, and
mm.
people are still quite nervous about that. And people are
Yeah.
nervous to tell the partner to wear a condom because then does it seem like I'm promiscuous and I
Oh
have an
my God.
STI or I've been sleeping around and I'm gonna give him. So that it's multifactorial, I think. And then condoms, there are so many men who have said, they don't like condoms or I don't like the way it feels. But honestly, condoms have developed. They've also moved, and there's thin, there's skin,
Mm,
there's
mm.
different types, and then him find the right size for him as well. There's different like sizes. Things have moved on. There's not the same standard Durex. Things have moved on. There's
Oh,
even
God.
extra large. You know, even lubricants.
Yeah. Yeah.
We
Yeah.
can't keep using that as an excuse. That
No, what's
but
in? Yeah, go on.
yeah, go on. But I'd say that obviously there are people who do find that they might lose their erection because of the tightness of the condom. But I'd say a lot of them as well, it's finding the right size and the right type. Um,
Yeah.
then it doesn't inflict. But there are people where it would still impact their erection.
And
Yeah.
we talked a little bit about. I'm going there. I want to talk about pleasure. If I'm
Yeah.
honest, I want to talk about how women have almost been denied pleasure, or don't feel that they can have sexual pleasure because the
Mm,
emphasis is on the man's pleasure.
man,
And I think, well, you said that men.
man.
But also, we get to a stage, you split up from your partner, you might be in your 50s, maybe 40s, your 50s, you're older. You wouldn't, you would have had sex education at school. Sex education at school, when I was at school, was they showed us a video. It wasn't even a video, it was on an OHP of a woman giving birth, screaming. And that was basically our sex education. It was basically don't do it until you're married in a relationship. Whereas nowadays,
Mm,
there are websites that you can go on to
mm,
that where there are, videos and places to help people to understand that not only is the porn that you might be watching or not watching not realistic, but also there are people who don't know what they like. They literally don't know
I don't.
what they like. Do you have thoughts or conversations about pleasure with men and women?
Yeah. I mean, one of the key things is I think we need to get better at talking about pleasure.
Mm,
So there's a company actually that look at the top myths, I
okay.
think 5 myths per year. And last year, one of they do basically myth busting. One of the key things that they had on their list was sex and pleasure, and I was
Mm,
part of the panel. And it's
I love it.
amazing that we yeah, we still like, there's still a belief that pleasure is for men, like you said
Yeah.
already.
Mm.
And I think when you talk about pleasure, people instantly think about male pleasure rather
Yeah.
than thinking about women having
Mm.
pleasure. And I
Mm.
think actually, men who have sex with men are way ahead in terms of pleasure and knowing their
Right.
bodies and prevention on sexually transmitted infections. I
Mm.
feel like women are definitely left behind, and this is why it's important that we're having these conversations and normalizing talking about the pleasure of women, because again, I think also we don't talk about the different stages of life and how that
Mm.
can impact our pleasure, you
Mm.
know because for instance, post if you're just had children, for instance, and you're postpartum, you know
Mm.
your pleasure is greatly impacted in that postpartum phase.
Yeah.
And then if we think about later on in life, your perimenopause, and I think it's important that we talk about the different, but again, I guess stripping it back is also talking about what you like. People don't know what they're like. And
This
I
is
think
the
it's important
thing.
to, one, examine your body, get to know your
Mm.
body, touch, feel
See,
again,
that is huge. I will say, I will
and
say,
know what
it's going to
is
be a long
what you
conversation. I was brought, my father was a preacher. Okay.
like. All right.
So I was brought up in a Christian household. We never talked about sex at home. All the information I found about sex was through a couple of friends who were way ahead of me at
Hmm.
school, and then a, a bit of porn, and then I was actually in relationships, and it was all about the man, the man, the man.
Mm.
Postmenopausal now. I'm also single. There are lots of single women out there who are not necessarily in relationships, but also still want to access pleasure.
Mm.
And I'm finding that I'm having to kind of relearn and mm, unpick the shame that came with touching myself, learning to touch myself. I mean, I'm way ahead now, but I remember when I first started this, when I first split up with my partner, which was when I was in my mid 40s, my emphasis was more on finding a boyfriend rather than rediscovering myself.
Yourself.
Does that make
Mm.
sense? And I think these conversations, a lot of the conversations around menopause and pleasure and sex tend to be around vaginal atrophy and having sex with your partner or with your husband and that
Mm.
kind of thing. And I would love also for there to be a conversation about single women who aren't necessarily in relationships or aren't, but still want to be able to access pleasure. What advice would you give to um, people socialized as women who are who need to be examining themselves, who need to be looking
Mm.
at their vulva in the mirror, for changes that are from a health perspective, but
Yeah.
also about discovering or rediscovering what it is to orgasm or to access pleasure and let go of the shame that goes with the fact that you're touching yourself. That was a long-winded
Yeah.
question.
No, definitely. You, honestly, you need to get to know down there. And you can do so much if you really get to know down there, right?
Mm.
Um, there is, yes, actually, I think the data from that charity,
Yeah.
they talked about the different types of
What's the name
pleasure
of the
that you can receive.
charity? Sorry, because I'm
So
going to
it's
run to Google when you finish.
talking taboos,
Talking
and
taboo. Okay.
yeah, and actually, I think it's them and another. There's obviously I'm always looking at different things, but actually penetration
Mm.
doesn't account for the most
It
pleasure.
ain't all that.
No, massage, kissing,
Yeah.
touching,
Mm.
even actually, even if you're not into like anal sex, just
Mm.
touching around that area. There's a lot of
Mm.
nerve endings, and people don't know that this.
Mm.
Those nerve endings, just somebody just rubbing and massaging that
Yeah.
area, people
Yeah.
can orgasm. So it's
Yeah.
just getting to know your body. And I think, you know, yes, penetration, for some women, that's the end all and the be all.
Mm.
But actually, for some women, like you're saying, if you're single, you can do it too. And there's toys,
Yeah.
you can explore. Go to a toy shop. They will explore, they will show you the different types.
Mm.
What
Mm.
there's like rabbits, there's all sorts of different stuff. There's a bullet,
Mm.
which stimulates the clitoris. There's so much out
What
there.
would you say there will be people listening to this who are loving it, and there will also be people listening to this who are curious and also
Cringing.
cringing. What advice would you give to someone who this is new to them? They wouldn't know, they would never go to what we call a toy shop or a sex shop or an adult shop.
Hmm.
They would, where would you send them? I know Sam Talks, if you're on Instagram,
Oh
Sam
yeah, some
Talks Sex.
talks.
Sam Talks is incredible and, speaks about toys and pleasure and that kind of thing. But I
Mm.
wonder if what advice or where would you send them?
Yeah, no, that's a great question. So I'd say that, yeah, Sam Talks shares a lot on her social media.
Mm,
If you're wanting to go to a physical shop, there is one in Westfields. Actually, there's more than one. I think there's two. There was
mm,
Anne Summers also has
mm,
towards the back. They've got a
mm,
whole section on toys,
mm,
lubricants,
mm,
and things like that. And then there's another one. I don't know what it's called, but inside Westfields,
mm,
it's an adult, so they've got lingerie, but they also have toys as well. And I'd
mm.
say looking online, there's another. Oh God, what's her name?
Not Joe Divine. No.
No, it's another. She shares around a lot, but there's so many people on social media as
Social
well who
media.
talk about
Yeah.
different toys and what's appropriate. And then with lubricants, just
Yeah.
be careful. Read the ingredients because some
Yeah.
lubricants are not great and they'll
Yeah.
change the flora, meaning that you're more susceptible to thrush and bacterial vaginosis. So really read the ingredients. Don't just go buying any cheap odd stuff.
Yeah.
I'm not saying that you're
Yeah.
into cheapos, but I'm just trying
Yeah.
to
Yeah.
emphasize of
Yeah. Mm,
reading the ingredients because you
mm,
want to water-based lubricants. Some lubricants might tell you that they're really don't have scented and all of that, but really read and avoid things that are really harsh and will change the flora because you don't need that. You don't need thrush on top of
yeah. Oh my
trying to get
God.
it to your body. It's going to be like a bit of a pleasure killer.
Yeah. And there's a
So,
wonderful website, and they've also got social media called Oh My God or OMG Yes,
mhm.
who are brilliant in terms of talking about all sorts of things to do with pleasure, not necessarily targeted at older people, but definitely. I don't know. I just feel like I'm what 63. And I'm of a generation where this is not something we talked about. And if
Yeah,
I, who talk about menopause all the time, find it, you know, think, find it, no, I don't find it cringy, but certainly if I'm someone who doesn't necessarily often talk about sex, and I'm fairly, I don't want to say new, but certainly, finding out more and more
no,
about
yeah.
how I access pleasure, then I know I'm not the only one.
Mm.
And I feel I would love more people entering menopause to understand, especially older people, to understand that pleasure is our birthright. And
It
pleasure isn't
is.
just about sex, but, an orgasm is good for your health. You're
It
going for a
is.
10K run, you're going for a 5K run, you're doing your weights three times a week. Make sure you get your orgasms in as well.
I agree. Those endorphins that you're releasing are so, so important. And I
Mm.
think, yeah, just normalize it. Like, honestly, we're, human are meant to be
Yeah, yeah,
sexual. So I think we just need to get more comfortable. But I think with us, we've also got the cultural and, like you
yes,
said, religious aspects
yeah.
that definitely impact um, how we view sex.
Mm,
So but I think, yeah, definitely, start getting to know yourself if you've not already done that. I think it's also important for younger people, really getting to know their vulva, their
yeah,
vagina, checking for any lumps, bumps, because honestly, when even if you came to us, let's say there was something and you wanted us to examine, we'll say, oh, when did this appear? When,
mm,
has it changed in size, shape? color and things like that. But it's also important to, if there is ever any lumps, bumps, you diagnose those early. You come to us and we examine you, and if you don't know, you won't find these until it's a lot late,
Yeah.
a lot later, sorry,
Yeah.
which, you know, it might not be anything serious, but if it is, we want to find these things earlier rather than later.
Yeah. You need to, as Eve say, know your normal.
Mm, no,
Know
you're
your
not.
normal.
Oh,
Yeah.
completely. So breast,
Yeah.
vulva, everywhere. you
Yeah.
know I teach my kids normal terminology because I'm all about empowering, so we need to also debunk this whole that it's not a vagina as if it's like
Yeah.
something like cryptic. So my
Yeah.
daughter will say to you, stop calling it a shushu, please. It's a vulva, it's a vagina. She doesn't appreciate all these fufus and shushus and
We used to
so
call
yeah.
it. We used to call precious. Yeah,
Precious.
my precious, my precious. The names we come up with to avoid saying vagina and vulva is actually
Yeah.
wild.
It is. It is. We could probably come up with a whole dictionary because I'm telling you, when you speak to different people, they've known
Yeah,
it as something else in their, growing up but yeah, we just need to normalize these words and talk about them. It's an anatomy and physiology word. Like, why are we now calling it something else and not calling it
exactly.
as it is?
I'm
So
presuming. I mean, your husband's used to you talking about your journey and talking about sex, obviously sexual health and that kind of thing.
yeah.
Are all your family like this? Are all of your family
So
open?
it's funny because I come from obviously an African household, and I'd say as much as my mom worked in sexual and reproductive health, it was almost like she told us stories in a way where don't do this,
Mm,
rather than actually we had an open discussion. I'd say
mm,
that now, probably me, who prompts everybody talking. My husband still cringes a lot. And over the years, I've been trying to get him to come to a lot of my talks, and he's like,
yeah,
no. Because he always says, "Oh, you're oversharing." You know how it is. You're
that's
oversharing is
interesting.
always the thing. But I think he's kind of used to it, but not used to it to come and listen to me
Yeah.
deliver
He's
talk.
proud of you. He's proud of you.
Yeah.
I'm
Oh, he's
sure.
my absolute
I'm
rock.
sure.
He's my absolute rock. Like, David. For me to do all the things I do, I couldn't do it without
Yeah.
him. Like, definitely, he's just amazing.
So I don't want to let you go. I'm not going to let you go. I want to ask because you talked about your mother. Has your mother spoken to you about menopause? Because obviously
Oh
you're 33, so you're not perimenopausal, or we
no,
don't think you are yet. But
no.
yeah, has your mum spoken to you about menopause? About
So
hers?
now we do. Yeah,
Ah.
now we do. I mean, I remember mom having like honestly like horrendous um hot flushes,
Mm,
in her, I'd say maybe mid 40s.
okay.
And we just knew that mom, has these moments. But at the time, obviously I was very young as well. So didn't know it was menopause because yeah,
Yeah.
how at that age, I think I was a lot younger. Um and yeah, we just, like even with my mom's sisters, it's like, okay, auntie's having her moment kind of thing.
Mm,
But never spoken about sort of what was happening and actually
mm,
what does this mean.
yeah.
Whereas now it's amazing because we have such great conversations about menopause and around her sisters. And like I said earlier, barely any of them use. I think only one of my mom's sisters used HRT.
Yeah.
But then obviously hypertension was told to come off,
Mm,
rather than actually you can still use it. I mean, nowadays we've got other options, whereas
mm,
maybe then we didn't have as many options. So
mm.
now I think in our household, especially like when we're meeting as a family, we all have conversations around menopause, sex, everything. Nothing is on like filter. And obviously the in-laws, so especially like my husband and other, they're like, this family is a bit too comfortable with each other. So like they kind of like, is this really happening?
I love it. I love
Um,
it.
but yeah, nothing
Yeah.
is off. We're just flowing.
I think it's brilliant. I think it's the way it should be. I love it. I absolutely love it. How
Yeah.
are you preparing for your menopause?
How am I? So I think,
Mm,
yeah, that's a good question. I've actually never thought about it. Like as in thought about how I should be preparing for
mm,
my menopause. But I guess the key thing is that working within women's health space, I feel like I know what path I'd go down. So I feel like I wouldn't be opposed to sort of using HRT. So,
Mm.
like I said to you earlier, post birth, unfortunately, I have a traumatized bladder. So, suffer with really bad urinary frequency and urgency.
Mm.
And I'm willing to use estrogen. If I wasn't told I'm too young, I'd definitely use it.
Mm.
So I feel like I'm definitely well informed. I don't think you can ever know everything, but I feel like I would definitely be open, but probably I'd be open to trying anything even now.
Yeah,
If they told me it was like preventative and we could definitely do it,
yeah.
I would do it. But I think they're trying to steer us away from kind of taking medication if you don't need it. But if I was told that definitely using this now would be beneficial, I'd be open to it.
Mm.
Um,
Mm.
so yeah.
Okay.
But I haven't done anything specific. Like I feel like I probably should be thinking about it. Um, but I feel like
I mean, in terms of like, I don't know, diet, exercise, lifestyle. I mean, you've got two young kids. You're full on, and you work all, a lot. So it's actually very difficult. It'd be all very well for me to say, "Oh yeah, go for walks." Do this, do that. But
yeah,
our lifestyles are very different.
yeah. Well, my guilty pleasure is running. So I've been running
How is
for
that guilty?
yeah, my guilty pleasure because I feel like why I call it a guilty pleasure is because I think a lot of the time people think you're a young mom, where'd you find the time? So
Right.
like for
Oh,
me,
so it's
that's
your
my
way of getting out of the
time.
house.
Yeah, to myself because being a young mom, it's full on,
Mm,
from housework to cooking to cleaning to all of that.
mm.
So I feel like that's my time. And I love socializing. So meeting friends for a drink, and I love a good drink. Yeah, don't drink too much. But I do love socializing. I'm such a
Yeah.
social bubble, and my husband's exactly opposite. So my husband's happy to stay indoors, whereas I'm happy to get out and
Oh, that's
socialize.
the
So
perfect
running is one of my
relationship.
I drag him to places a lot of the time
Mm,
because, yeah, I just love socializing. But yeah, running is my thing because, I like dessert, like alcohol, and those things are obviously,
mm.
what 1 minute on the lips, a lifetime on the it's kind of thing. So I've always run. Like I've run since I think I finished uni 21, so
Oh
over 10
wow.
years, and I really enjoy it.
Mm,
There was times I used to run with my daughter, and she'd be on her bike and things like that, but
yeah,
I found it too stressful. So now I'm like, no, this is mummy's time,
I love that.
and she respects that. So yeah, I tend to do early morning runs, so I'm an early riser, which is why I sleep at 9 because I tend to like to wake up at 5. That's how I start my day running. Pilates, depending upon if my husband's home. Yeah, I go for a run. If he's not home,
That's
then I
really
do
interesting.
Pilates in the morning, read my Bible, start my
Mm.
day like kind of right. And yeah, that's
And
been like the norm for years.
even though the question was how are you preparing for menopause, and your answer was I'm not. I haven't thought about it, and yet you've actually named some things that will be very, very beneficial,
Crucial.
even when it
Yeah.
just comes down to having a routine,
Mm,
and going to bed. Because you said you go to bed at
naked.
9,
Oh
which
God,
is,
yeah. I love.
by some standards, fair. I was going on about how I'm really pleased I got to bed at 10:30, and my girl's going to bed at
Today.
9.
Oh
But that's great because that works
yeah.
for you.
9 is definitely kids 8, you know, us 9. It just works perfectly. I mean, I do let them run wild for an extra hour on the weekend, but yeah, I'm definitely one of those moms that thrives on having my kids in bed by 8. Um,
Oh my god, I love
but
that.
I'd say I'd do better with diet. Definitely, I feel like again with African diet, we do meat a lot,
Mm.
and I think we could definitely change that. We tend to have stews or
But it
red
tastes so
meat.
good.
It does, but I could do better. My husband always tells me off because I could do better with the veg and like, we have days where we're like, okay, fine, we won't do veg, we'll do a veggie
Yeah,
pasta bake or something. But
yeah,
we eat meat a lot. Like
yes.
we could eat meat 5 days a week, which is quite a lot.
Yeah,
But I
yeah.
think that's just the norm in sort of
Yeah, yeah, yeah,
where I
yeah,
come from. So yeah.
absolutely. How do you
Yeah.
celebrate yourself?
Oh, really badly. Nothing. I don't really do anything.
I
And
read a bio that had so many things in it. You are a wife and a mother. You have two wonderful children. Surely it is time to start
oh,
celebrating yourself.
I need to do better.
Mm.
My husband probably celebrates me a lot better than I do. I think I
Oh,
suffer probably from imposter or something where, you do so much, but you don't really, not that you don't see it, but you don't
mm,
really celebrate it
mm,
per se or recognize it, you
mm,
know. Um, my family probably are my biggest cheerleaders. So besides my mom, my sister,
mm.
um, it's like my husband and my sister who are so me and my sisters talk all the time. Like literally, my mornings start as well with
How
talking
many
to my
sisters do you
sister.
have?
I've got one.
Okay.
Um, and we start our day with talking to each other. We speak to each other at lunchtime, the end of the day. Um,
It's
and David will
lovely.
be like, "What are you
Beautiful.
guys saying to each other?" We just have so much to say to each other. So yeah, I feel like my family probably celebrate me. My cousins, I've got a lot of cousins because, like I said, my mom, there's a big family.
Mm,
So yeah, my family probably celebrate me a lot better than I do,
yeah,
because for me it's work and it's passion and some of the things I'm doing. I'm thinking I shouldn't be doing these because it should be Black
yeah.
women should be taken seriously and should be
Mm.
heard, should be seen, should be. So for me, it's like that passion. I don't really, yeah, I don't see it as something I need to be celebrating because a lot of us wouldn't be doing this work if the right things were happening.
Well, this is your
So
call to action then. This is your call to action. Find a way to celebrate yourself this week, please. Auntie Grandma Karen is telling you now.
thank you.
You
Thank
are
you.
worth celebrating. It's great that you have
Oh,
people around you who are doing so, but yeah, it could be anything. What brings you joy?
my family.
Mm, that's
My
nice.
family, my kids, and
Mm.
I've got a little chatterbox like me. So I think we're competing for the stage, really. But yeah, my family and my husband honestly really bring me joy,
Okay.
and including, yeah, my extended, even my cousins. Like we're such a close family.
Oh,
We do so much together. So half terms, my daughter knows that we always go to like one of our aunts in
mm,
Ipswich. There's
right.
two of them actually who live in Ipswich, and like family time for us is everything.
Oh,
And we were brought up like, even though I lived the first 9 years of my life in South Africa, every you know school term when it breaks
yeah.
up, we'd go to Zimbabwe to see
Yeah.
our cousins. So we grew
Oh,
up
lovely.
close knit. And yeah, I want to instill that in my kids so that they know that family is everything, you know.
Beautiful.
And I've
We,
acquired family friends who are now
yeah.
family. So
Oh.
yeah.
Now you're a social animal. Which tune instantly makes you want to dance?
Oh my God, I've got so many. So being South African, I'm a bit biased because I love Amapiano. So when you
Okay.
posted that video that had Amapiano, I was like, yes. Um, but to be honest, I just love anything with a beat and love a good dance. So
Okay.
I've got so many I can like, and to be honest, I like 90s music. I'm sort of an old at heart as well, like that old school music definitely does it for
Okay.
me.
Okay.
Um, and then newer, I'd say, yeah, definitely I'm a piano and I like a bit of Afro beats as well.
Okay.
Yeah.
Okay. Good. I only asked because we have a playlist, season
Oh, you
eight,
wanted to play me
that I'm
something?
putting together. No, there's a playlist.
Ah,
So I'm going to
playlist you're
add.
putting together.
I'll add something. I'll look at the reel that I put that Amapiano on, and I'll put that. Um, I'll put that on
Yeah.
it.
So I'm gonna
Last
tell you something
question.
else.
Oh, go on. Oh,
I we DJ. Well, my husband DJs professionally,
oh, wait, hold it.
more
You're
professionally
saving
than
this
me.
to the end.
And then I do it as a hobby, and now we're
Okay.
teaching it to our kids. Yeah, so we're really
So you're
into
going to be a
music.
DJ family. I love
Could you
this.
imagine that?
You
I've
heard it
posted
here
video on
first,
my
folks.
personal page of my son and my husband DJing.
Oh, I love that. I love
Yeah,
that. Oh my goodness. And yet, that's no wonder you can't think of a tune then, because there's too many in your head.
there's too many. Yeah.
Okay. Final question. We talked about healthcare. What's the one piece of advice you would give to anyone listening to us right now?
Um, I really feel that, a lot of us go into healthcare to care for people,
Mm,
and there are a lot of healthcare professionals who really care and who are there to listen to you and, give you your choice, any health related issue you have, talk about what the choices may be, if it requires treatment, management, or anything like that. So I just want to say to people that, it's not all doom and gloom when you go to healthcare. There's people
yeah.
who are there who genuinely care, you
Mm,
know, and actually there are people there who can be your biggest advocates as the healthcare professional, because I actually strongly believe that actually we should be your advocate first. You know, yes, you may need to advocate for yourself too. However, I think your biggest advocate should also be healthcare professionals who are in that space. So don't be disheartened,
mm,
we're not all, horrible and don't listen and won't take you seriously. There are a lot of us who are still there, who are there and will support you and will support your decision, whatever decision you want to take. So come and see us. And yeah, take somebody with you if you are feeling nervous or you feel like you need somebody else to advocate for yourself. Write things down or draw things or up. um, but yeah, just remember also that you're the best advocate for you.
mm. Thank you. Thank you, Simphiwe. You've been wonderful. Thank you for talking to me. Thank you for joining me.
Thank you for having me.
My absolute pleasure. Well, Simphiwe really went in, didn't she? I loved talking to her. I feel like I had so many questions that were definitely not the ones I normally ask, but I loved how honest she was with her answers. As you know, all of my guests are, to be fair. But yeah, I was particularly interested in what she said about pleasure. You know, humans are meant to be sexual. I think there's this misconception around as women, get older. There's this thing about us not only becoming invisible, but suddenly not becoming interested in sex, or even, it's just we don't hear about older women over 50, over 60, enough being sexual beings. But actually, 50 is often the time that we peak. We get a lot more, we can get a lot more energy as long as we've got our menopause care sorted. This is the time to really lean into pleasure. And also a reminder that pleasure isn't just about sex, but sex is not a taboo. So I loved having that conversation. Do check the show notes. I've put lots of websites in there. And I've put some links in there that you can do some more reading and do some more watching as well. And contact Simphiwe. You can speak to her. You can follow her on Instagram at Black Nurses and Midwives. But again, I'll put all of that information in the show notes, like I always do. Yeah. So that's it. That's it for episode 7. Not season 7. We're not done yet. Not season 8, I mean. I'm getting my words muddled. It is late, and I am recording this intro way before I'm about to go on the Joy Retreat Barbados. But by the time this comes out, I will have finished our retreat. If you're interested in joining the Joy Retreat Barbados, the world's first retreat that is for Black women only in any state of menopause, do sign up. Email hello@menopausewhilstblack.com, or I will put a specific link in the show notes as well, because in 2026 we go again. If you enjoyed this episode, if you're enjoying these episodes, please like, share, subscribe, keep talking about menopause. We are the generation that is making menopause matter, and I am proud that we are moving forward with all of this knowledge, because that means that people will get the menopause care that they need and they deserve. That's it. Drink your water, wear your SPF, go gently, and I will speak with you soon. Okay, bye.